Hi, I'm Ruth Hanston. I'd like to take just a few minutes to discuss with you today a couple of issues that I see occurring from a national perspective in terms of how we affect our patients and our families in our relationships with them. You've often heard me talk about creating healing moments, and that I believe that the building blocks of healthcare have to do with the relationship with the patient and the care provider. And today I'd like to talk about the two major gaps that I see occurring. Number one is self-management. I think that we may need to really reflect a little bit on how we're able to manage the chaos that is often present in our unit or department, and really being able to focus on being present in the moment with our patients. So the first thing, again, is to think about how we manage ourselves. Secondarily, I'd like to talk just a little bit about that outcomes focus, or the results part of relationship and results-oriented healthcare. So first of all, self-management. For those of you who are expert practitioners, this isn't really a problem. You know how to create a sense of calm and presence and connectedness with your patients and families. But for some newer folks that are just learning how to be able to manage all the complexities of the work, they may have some difficulties. So we hope that you that are experts will talk a little bit about some of the things that you do to help manage yourself and your workload. For example, taking deep breaths before you enter the room, having your brains or your laptop or your tablet ready so that you know what is going on with the patient, and recalling that shift report at the bedside that you so recently conducted. Maybe the gelling in and gelling out, that washing of the hands might be something that will help you focus on letting go of some of your other concerns and really realizing that while you're there with your patient, there's really nothing else you can be doing except being totally there. So let's make the best use of the time that we do have with them. Also, we might recommend, and we have recommended, sitting at eye level or being right by the patient at the bedside, leaning in, nodding, really paying attention and listening actively. Those are some of the ideas that we have about self-management in the relationship that you have with your patient. Secondarily, let's just take a minute to talk about that outcomes focus. Many of you may be involved in service excellence programs, and we're all for those. We think that, introductions and, explaining treatments and the duration of waits and all of those things, and even gratitude to patients and families, thanking them for choosing your organization for care. Those are very important ways of showing the patients and their significant others that we care. One of the things, though, that we think is missed in service excellence programs is that sometimes people aren't focusing on the outcomes, the results that the patients and families want to achieve on the short term and the long term. An example of a short-term goal or result that they might want would be knowing what their plan of care is for the next couple of days after their emergency surgery, or dealing with pain or nausea, or perhaps finding out who's going to pay for this hospitalization. That would be perhaps a short-term goal. A long-term goal might be, what are we going to do with Mom after this fall and this hip pinning? Where is she going to go? Will she be able to go back home? Help us figure out how we might discern how to help Mom be as active as possible and as independent as possible. So, two things today in our short discussion that I wanted to chat with you about. Number one is being sure that we're managing ourselves effectively when we create a relationship with our patients and their significant others and families. And the second thing was that results orientation or an outcomes focus. So remembering that in relationship and results-oriented healthcare, there are 10 basic best practices. And we've just discussed today how to really manage yourself, a few tips, and also how to maintain that outcomes orientation. Thank you for joining us today. And thank you for all that you do for your patients.